Hello, and welcome to Just Therapist Things, where we talk all things therapy. My name is Jordan, and I am an associate marriage and family therapist from Southern California. I currently work in a private practice where we focus on child anxiety reduction, and I also do some work for a nonprofit cancer support organization. In this episode, I will share my story with physical symptoms of anxiety, detail the biology behind these symptoms, and give insights on how to help. So first for my story. I have had little bits of anxiety throughout my life, but in my junior year of college, I was hit with intense dizziness, lightheadedness, chest tightness, numbness in fingers, and extreme fatigue. Looking back on it and just reflecting on that time, I can see now that there were some stressors that probably prompted this intense anxiety, but in the moment, it just came on so suddenly and was so shocking. Of course, I thought something was really wrong with me. I went to multiple doctors, urgent cares, and I was told that I had a cold, the flu, mono. Everything came up negative, and I was given some prescriptions and just told to rest and relax, and it would go away soon. Of course, nothing helped. I was incredibly discouraged that nothing worked and no doctors seemed to be helping me. And for months, I was unable to function, and I thought that I had a rare illness that would honestly eventually kill me. As you can probably guess, I felt very hopeless and was teetering on depression. I kept this suffering pretty quiet, and I would just tell my friends little bits and pieces of what was happening. Only my partner and my mom really knew the extent of what I was going through, but it was hard to share because I did not understand it myself. I just knew that I did not feel like myself, and something was very wrong in my body. One of the multiple doctors that I saw did actually tell me very passively that my symptoms were just anxiety. I did not believe him for 1 second because he did not explain himself. He just said it very passively. I always think back to that doctor's visit of how things could have turned out differently. If he had approached me with a little more empathy and told me about the physical manifestations of anxiety, given me a little bit of psychoeducation, I may have believed him. And this could have prevented me months of suffering. So moms always know best, and my mom suggested that since it seemed like nothing was medically wrong with me, maybe it is psychological, and maybe I should see a therapist. I was very hesitant at first because I was so convinced that something was physically and medically wrong with me. But at that point, I was willing to try anything. I remember the drive to the first therapy appointment, and I had to stay on the phone with my mom the entire time because I felt so dizzy and so lightheaded that I thought I was going to crash the car. And I was so scared. When I got to my first session, this therapist treated me with empathy and respect and validated the reality of my physical symptoms. She educated me on how anxiety can cause major physical symptoms. I remember also having my eyes closed during session because I was too dizzy to even focus, and I had to leave the room multiple times because I felt like I was going to pass out. My symptoms were very real. But after that first session, I did have some buy-in that maybe this was just anxiety. It took many therapy appointments. I was going twice a week at first, and then I went down to once a week. And these therapy sessions were a lot of repetition, psychoeducation, validation of my symptoms, and empathy. But I finally really believed her, really believed my therapist, and I started to implement what she was telling me, and I started to see a change. Before this therapist, I had no idea that anxiety could manifest as physical symptoms. Absolutely no idea. And this little fact changed my world. And I am on a mission to make sure that everyone knows what anxiety can do to the body. I soon enough got a diagnosis that finally fit. Because I had such intense physical symptoms, my generalized anxiety morphed into panic disorder with a health anxiety specifier. I was hyper aware and fearful of any little tiny sensation in my body and convinced that everything was a major health concern. Even after I started to experience major progress, I still had frequent panic. And honestly, I still have those thoughts sometimes when I feel a weird sensation in my body. Then my mind automatically goes to, it is something that will kill me. It is a major health issue. But I have gotten way better at challenging those thoughts. It took close to a year of really hard work. As I said, a bi-weekly and weekly cognitive behavioral therapy and medication help. But I was finally really able to manage my anxiety and panic, and I was able to function again in college. Years later, I am in a place in my life that I honestly never imagined I could get to when I was at my lowest. And I can manage even when anxiety spikes. So what even is anxiety, and what happens in the brain when anxiety comes? So anxiety is a normal reaction to threat, but sometimes the anxiety response is activated even when there is no real threat. This is what characterizes an anxiety disorder. When there is a perceived threat, our brain responds and activates the fight, flight, or freeze response. The fight, flight, or freeze response is the natural way that our bodies and minds respond to danger, and the distinct response actually varies person to person. What I mean by this is that our innate and learned experiences affect our anxiety responses. For example, if someone grew up in a house full of siblings who expressed their emotions through physical fighting and name-calling, that may lead you to have a default fight anxiety response. If someone was born naturally a bit timid and anxious and learned that the way to avoid conflict is to escape the situation, the learned anxiety response may be flight. These are just some examples, but the reason for your specific anxiety response depends on many factors, and there may not be a clear reason at all. With my kid clients, I explain the fight, flight, freeze response in terms of animals, and I think that this is actually really useful for adults to conceptualize as well. So I have the kids draw a lion, a bunny, and a mouse. And I say to them, so what do you think a lion does when it gets scared? And they usually say it growls, it tries to fight. And I say, yes, exactly. It tries to fight the danger by growling and fighting with its body. So it uses words and its body. This is the fight response. What about a bunny when a bunny senses danger? A bunny tries to run away from the danger, and this is the flight response. The bunny tries to escape the threat and go somewhere safe. And what about a mouse? A mouse freezes in place and tries to get the danger to just go away by pretending that it is invisible. That is the freeze response. Of course, this looks a little different in humans, but hopefully you get the idea. So when anxiety comes, what is happening in the body? The neural structures that play a role in anxiety and fight or flight are the amygdala, prefrontal cortex, and hippocampus, which are all part of the nervous system. The amygdala processes threat and danger. The prefrontal cortex is involved in executive functioning, memory, and decision-making, and the hippocampus is involved in memory and spatial navigation. The hormones involved in fight or flight response include adrenaline, norepinephrine, and cortisol, which trigger various physiological responses in order to prompt your body to flee the perceived danger. Let's go over some specific anxiety symptoms that can happen and their biological reason when a feared stimuli is present. First up is heavy breathing. Heavy breathing happens because in order to get away from the danger, we need an increased respiration rate to get more air into our lungs so we have higher oxygen levels. Unfortunately, this can feel like hyperventilation. Another physical symptom is heart rate increase, and this happens to provide increased blood flow and energy to the body to aid in the rapid response to the perceived danger. Nausea and stomach discomfort can also happen because the fight or flight hormones create an imbalance in the gut microbiome. And dizziness and lightheadedness can happen due to the rush of adrenaline. Numbness and tingling in the hands and feet can also happen, and the reason for this is that your blood is diverted away from your limbs to more essential regions in order to protect your major organs that are in your torso. And this is to prompt the fight or flight response and get you away from danger. If you have any of these sensations, the first order of business is to get checked out by a doctor. You know your body best, and if something feels wrong, trust that instinct and get yourself checked out. Do not delay medical appointments. However, if everything is cleared by the doctors and you've done labs and all of that and everything seems normal, there is a possibility that these physical symptoms could be anxiety. Look for evidence that these physical symptoms are not a medical issue, but could be anxiety. So some signs that these symptoms could be anxiety are if the symptoms are inconsistent. So if the symptoms are sometimes there and sometimes not, and you notice that they're not there when you are doing something enjoyable or calming, and they are more present when you're doing something stressful. So that is one piece of evidence, and this is something that really helped me to think about my symptoms logically, because if I had a headache or I felt dizzy, my mind automatically went to, I have a brain tumor. And my therapist really helped me to think about it logically, because the dizziness and the headaches were not always there. And she said, if you had a brain tumor, then the symptoms would most likely always be there. They would be more constant. They wouldn't be coming and going like they are. And so that was very, very helpful, just to think about the evidence and to think about the symptoms in a logical way. Another piece of evidence is that after you start seeing a therapist, if the therapeutic techniques work, then that is a sign that these symptoms are probably anxiety. Because if it was a true medical issue, then using therapeutic techniques would not help the symptoms. If they are being helped, then that is amazing, and it is most likely anxiety. Something that I was plagued with during my therapy treatment, and something that is very, very common, is the what if thought spiral when you start to do the work. And so the what if thought spiral, for me, it centered around worries around misdiagnosis. Well, what if these physical symptoms are actually a medical issue? What if something is actually wrong with me? What if I was misdiagnosed? And that is very, very normal and common to happen, especially when you have really intense physical symptoms, because it is hard to tell yourself that anxiety is causing it. At first, it does feel like you're crazy. It feels like your mind is playing tricks on you, and your mind is causing your body to have all these weird symptoms, but they are real symptoms. Even though there is not something medically wrong, these symptoms are as real as if there was something medically wrong. So it is very normal to have the what if thought spiral, and your therapist can help you with that. So I keep mentioning therapy, of course, because I am a therapist, and I think that everyone should see a therapist no matter what is going on in your life. But also, if you are having these intense physical symptoms or any kind of physical symptoms of anxiety at all, it is really important that you do not try to treat this on your own. See a professional who can help you. So I would say that it is important to see a therapist who specializes in CBT, cognitive behavioral therapy, because that is the main treatment and what has proven to be most helpful with anxiety disorders. CBT is helpful to identify the negative thoughts that come in and the what if thoughts and challenge them. It is really important to name the anxiety and identify the progression of the anxious thoughts. And part of CBT also is that you can uncover, where did these thoughts come from? Why did they start? And how can I reduce my stress and anxiety? Something really interesting that I learned from this therapist who helped me is that sometimes the physical manifestations, they are prompted by something in your past. So for me, my main physical symptom was dizziness or lightheadedness. And we uncovered that that was because of a history that I had, familial and also personal history of fainting. And maybe that is why my fears were so extreme when it came to dizziness and lightheadedness, and why that was my main physical symptom. So that is something else that CBT can help you uncover, is why do I have certain physical symptoms? Why are some specific ones happening rather than others? It is also necessary to find a therapist who gives you lots of psychoeducation on the physical manifestations of anxiety, because you need to achieve buy-in. You need to really believe that this is anxiety, or at least mostly believe that it's anxiety, in order to see any progress. And the therapist should also really engage in mindfulness and coping strategies such as breathing, use of essential oils, good nutrition, good sleep, exercise, and just really encouraging that routine. So let's talk about breathing for a second. When I first got into therapy, I really thought that breathing was BS. I thought that no way this works. But at that point, I was really willing to try anything that could help. And lo and behold, it actually works. So I tell my experience of skepticism to my clients as well, the clients especially who are skeptical of breathing, and I give them some psychoeducation on how breathing is helpful. And I teach them the ways to do breathing so that it actually works. So something really important to remember with breathing is to exhale for longer than you inhale. And the reason for this is that exhaling longer than you inhale, it signals to the parasympathetic nervous system that it is time to calm down. Something that is also helpful with breathing is to inhale through your nose and exhale through your mouth. And you can do breathing with essential oils as well. Another piece of treatment for anxiety, especially higher anxiety levels, are medications. And the most common medications in treatment for anxiety include SSRIs and SNRIs, but it can also really depend on just your metabolic system and your ability to process different medications. If you do need medication, then your therapist will refer you to a psychiatrist. The psychiatrist will evaluate you and then most likely start you on a very low dosage of medication and taper the medication lower or higher, just depending on what works for you. A huge important takeaway from this episode is that this is not a substitute for therapy. This is simply informative and educational, and it is super, super important that if you identify with any of these feelings, physical feelings or anxiety feelings that I addressed in this episode, you see a medical professional, and also you could get mental health support. Know that if you are experiencing physical symptoms of anxiety, you are not alone. And you are not crazy, and you are not making these symptoms up. These are very, very real, and they deserve to be treated as very real physical symptoms. You also deserve to get the care and support that you need in order to function. I hope you found this information useful and meaningful. Thank you so much for listening to Just Therapist Things, and next week I will be releasing a new episode on a topic that is part of the mental health field, but it is something that is pretty unknown and not talked about often. So look forward to that, and I will talk to you soon.